Good afternoon, everyone. Thank you all for joining us. We appreciate it. We're going to go ahead and get started. We were trying to give a few more minutes for everyone to join, but Chanel will be watching the chat for me to let me know if anyone else wants to join. All right, so we'll go ahead and get started. So tonight we're going to be talking about navigating care and benefits. This is a community partner information session. However, it is beneficial to caregivers as well. So anyone can join this session who is in the long-term care community. So before we get started, we love to know who's all in the room. Please feel free to go ahead and drop in the chat your name, the organization that you work for, and the population that you serve. Also, if you can drop in the chat one challenge that you're currently seeing with families or patients navigating long-term care and benefits. And while you guys are all doing that, I just want to share that my business partner, Chanel, she's in the chat with us today. She'll be monitoring the chat and capturing any questions or items that come up so that we can address them during our Q&A session at the end. And then I'll be fully focused on walking you through today's presentation. So I won't actively be monitoring the chat, but don't worry, Chanel, make sure that we capture everything so we can answer all of your questions before we wrap up. All right, so so if you can just drop your name and maybe the organization or agency that you work for and the population you serve. And if you don't work for an agency or organization and you're a caregiver, just drop your name in the chat and that you are a caregiver on today's session.
And if you are having issues with chat, you can also come off mute as well, whatever you're comfortable.
All right.
Okay, so we got your Costa Foster. She's from Hampton Newport News Community Service Board. And the biggest challenge she sees is affordability. That's pretty much around the area over here too, is affordability of long-term care.
Yeah.
Which is why we created our business, to help with the affordability. So you'll learn more about that.
All right. Well, welcome everyone. I just want to thank you all for taking the time to be here tonight. I know weekdays are pretty busy for everyone, so we just truly appreciate you guys taking the time to be here with us tonight. And we value the work that you do in the community and the populations that you serve. All right. So who are we? Who's ClearPath Care and Medicaid Consulting, right? My name is Shay Rather, and I'm the co-founder of ClearPath Care and Medicaid Consulting Group. I've been working in this field for 10 years, and I'm specializing in Medicaid, Medicare, and long-term care services. In my previous role, I served as the Medicaid and Medicare specialist for the Centera PACE program. Not sure if you all are familiar with it. Where I work closely with families navigating some of the most complex and overwhelming care and benefit situations. During my experience, it really opened my eyes to see just how many gaps exist in healthcare planning and benefit systems, and how often families are left trying to figure it all out on their own, especially with the population that we serve because we work with the geriatric community. So I'm so proud of the work that I do alongside my business partner, Chanel Tyson. Chanel brings a powerful social work perspective to our work, especially when it comes to care, navigation, family support, and connecting clients to the right resources. So I'll go ahead and turn it over to Chanel so she can introduce herself and give a little bit more about her background.
Hello again, everyone. Like Shay said, I am one of the co-founders of ClearPath Care Medicaid Consultant Group. I have been a master social worker going on 5 years. I am currently a hospice social worker. So I have been in the geriatric field the entire time. And of course, like your Yokosa said, the challenges I've seen was the affordability, the gaps in care, and, families not knowing how to navigate long-term care. It is very complex, and each person has, a different situation. So what I do is help in the care navigation part, help families find a clear path to whether it's long-term care, whether short-term care like respite, caregiver burnout, caregiver stress. My goal is to make sure as a social worker that I'm your advocate, the family's advocate, and the patient's advocate, and ultimately get them to the goal of whether it's long-term or short-term care. And On top of being the hospice social worker, I do have background with mental health. So that's my biggest passion with helping the clients and the caregivers. So that's me in the spiel.
Thank you, Chanel. Really appreciate it. So together, our mission is to provide clear guidance so families can make confident decisions, especially during some of the most overwhelming moments of their lives. So what do we do? At our core, we specialize in care navigation and Medicaid and benefit consulting. That's our biggest service that we provide. But our work goes far beyond that. We support individuals and families across a full spectrum of long-term care and benefit planning, including preparing for long-term care early before a crisis happens. We assist with preparing living wills, power of attorney, advance directive documents. We connect families with long-term care insurance providers. So a lot of people aren't aware that Medicaid is not the only long-term care payer. And there are private long-term care insurance providers, and even some life insurance policies offer coverage for long-term care. But you do have to start paying into those before you actually need them. So most people start planning for long-term care between the ages of 45 to 55 to keep costs affordable. So we get people connected to insurance companies and insurance brokers to help with those policies. We also support disability applications, whether someone is applying for the first time or navigating a denial. We assist with Medicare enrollment and Social Security retirement benefits. We guide veterans and their families through VA benefits, including aid in attendance and survivor benefits. We provide troubleshooting for denied, delayed, or stuck Medicaid applications and disability claims. We also provide crisis navigation and rapid response when families get into a crisis and they don't know where to start. We also provide mobile notary services. And then we also step in during some of the most critical moments that families face. So we provide critical care navigation, including hospice enrollment, facility placement, such as nursing home, assisted living, group home, when someone is experiencing a sudden health decline or major transition. So while we exist because both Chanel and I worked alongside each other in this industry for years. And we've seen firsthand just how complex and overwhelming the care systems and benefits can be. So families used to come to us constantly for guidance. And one day we looked at each other and said, imagine how many families are out here trying to navigate this complex system all on their own. And because of that, because this system was designed to be so complex and overwhelming, and a lot of the times critical care decisions are often made under pressure without the correct support or guidance, that is why we exist, to bridge that gap between between care and benefits. So our vision for our future, or for the future of ClearPath Care and Medicaid Consulting Group, is to eventually expand into a nonprofit to deepen our community impact and increase access to resources to ensure underserved families have the support that they need, not just when they can afford it. Because let's be honest, in today's economy, someone shouldn't have to choose between getting help for their loved one or putting food on the table. So sessions like this are incredibly important because they help us demonstrate the real need that exists in our communities. And the more that we show the challenges that families are facing and how this information helps support them, the stronger our ability is to bring this nonprofit vision to life. So at the end of today's session, we'll ask you to help us with our vision by completing a brief survey to share your feedback on how this information impacted you and whether it was helpful. Your impact directly supports our mission and helps us to continue expanding access to families who need it the most. All right, so I briefly touched on who we are and what we do, but now I'd like to take just a few minutes to provide more in-depth context around the services that we provide and how we support individuals, families, facilities, and community partners while navigating long-term care benefits and complex health care transitions. So a big part of what we do is care navigation, which Chanel is in charge of and leads. We guide families through care decisions from start to finish, whether they're planning ahead or in the middle of a crisis. We assist with facility placement. We assist with hospital and SNF discharge planning. So if someone is needing to go home after being hospitalized, but they need services in place to live at home safely, we help get those services in place so that way they can go home. Or if they can't go home, maybe they need to go to a long-term care. We help with all of those types of transitions. We also coordinate with providers and families and community agencies. So that may look like Chanel sitting in on care plan meetings with the medical team, or sometimes, unfortunately, it could look like Chanel having to contact the Adult Protective Services if she suspects physical, mental, or financial abuse. We also provide ongoing planning and transition support. So I'd like to share with you a brief success story from one of our clients or about one of our clients. We recently supported a client during a critical moment after her father had been hospitalized. And he had a rapid health decline, leaving his daughter overwhelmed without a clear plan. So within 24 hours, our team was able to step in and coordinate initiating the UAI, getting the UAI or with the uniform assessment instrument, which is also called a UAI, during the hospitalization, which was a key point in getting the client approved for long-term care Medicaid and placed in a nursing facility in under 45 days. So we got all of this done in under 45 days from start to finish. We were able to go to the hospital to complete the Medicaid application and maintained consistent communication between the daughter, the Department of Social Services, and the facility. And so the outcome of that was the Medicaid got approved within just weeks. It allowed for a seamless transition to long-term care right out of the hospital. And then we also guided the family on patient pay, and we provided strategic support to preserve eligibility while giving them time to sell the client's home, because he did have a home in his name, while maintaining Medicaid eligibility. So the key takeaway here is when care navigation and benefit strategy align, families gain clarity, they avoid delays and feeling confused and overwhelmed, and are able to move forward with confidence. Another big part of what we do is Medicaid and benefit consulting. So I'm going to ask you all a polling question before we get started on this session. I have a few polling questions. The first one is, how comfortable are you, or how comfortable do you feel explaining the Medicaid process to families? That's the first one. And then the second one is, how many of you know what a Medicaid spin down is, and how comfortable are you explaining it to families? So first one, how comfortable are you explaining Medicaid process to families? Are you very comfortable, somewhat comfortable, not at all comfortable? And then how many of you know what a Medicaid spin down is, and how comfortable are you explaining it to families? Do you understand it well? Do you feel confident explaining it? I have a general idea, but I could use more clarity, or you've heard about it, but wouldn't feel comfortable explaining it, or you're not at all familiar with it. I'll give you all a quick. Okay. So I see some people say somewhat comfortable explaining it. So I see a lot of people saying not at all. Um, and then I see some people said that they have a general idea, but could use more clarity explaining the spin down. Okay. And then I see a lot of people saying not at all comfortable. Okay. All right. Thank you so much for participating in our polls. Okay. All right. So I want to go ahead and explain the difference for those of you who don't know or explain what a spin down is. So there's two types of spin downs. You have an asset spin down and you have an income spin down. The income spin down is the one that you probably see the most or deal with the most in long-term care. Income spend down is, let's say the Medicaid income limit is $3,000, and let's say you have a client who makes over $4,000. Well, obviously they make over the Medicaid income limit, right? So what a spin down does is it allows you to still become eligible for Medicaid, although you make over that limit. And how that works is if you have enough medical expenses coming in, does not mean that you had to pay them. You just have to have accumulated enough bills, medical bills coming in. And the worker will look at your income. They will decide on what your spend down number is. You'll get a number saying that you have to meet or exceed this. You have to meet or exceed this every month in order to qualify. So once they give you that number, let's say our client makes $4,000, but they're in a nursing facility. Nursing facilities cost anywhere between $6,000 to $12,000 a month. So obviously, if their spend down number is $2,500, obviously they're going to meet that, right? And they're going to meet it monthly because the nursing facility rates pretty much stay the same or they get more. So that's how people are able to still qualify for Medicaid, even though they're over the income limit. And then you also have an asset spend down. So let's say same client, a client makes, let's say this time they make $2,500 and the income limit is $3,000. So they meet the income limit, but then they have $6,000 in their bank account. With Medicaid, you're only allowed to have $2,000 in your bank account. If you have over that $2,000, you're considered to be over the resource limit. And I'm just using the bank account as an example. There are other assets out there. But if you have over the $2,000 in your bank account, then you are considered over the limit. So we help them with a strategic plan on how to maneuver that money in a Medicaid legal way that will help them get approved. So that is how ClearPath comes in and helps. And that's the difference that we make is because we know the Medicaid rules, laws, and regulations to help navigate and get people approved. So that is what a spin down is, and that's how we help with spin down planning and strategic planning. We help families understand what they qualify for and how to get it and to avoid costly delays. We also provide Medicaid eligibility pre-screening and application guidance and support. We also complete Medicaid applications and submissions and document preparation. And I just went over the spin down with you. We provide the spin down and over resource strategy, case strategy, and then we also provide patient pay, education, and case monitoring. And then we also do the troubleshooting if someone was denied, or it may appear that they were denied, or they have a delayed or stuck application. All right, another part of what we do is long-term care planning, which we touched on briefly in the beginning. It's a big part of what we do is helping families prepare before something goes wrong. So that looks like having advanced planning consultations. We help families understand what they need to be prepared for in the future, what their situation could look like financially, what they want to use, if they want to use long term care, like a private long term care, do they want to use Medicaid, or maybe they have VA connections. We analyze all of that and help come up with a plan. We also assist with getting the right documents in place, such as power of attorney, living wills, advance directives. We also notarize those documents as well. Um, and then we provide long term care planning guidance. So, clear step by step support and care options, cost, and decision making pathways. And then the financial and benefit strategy. So Medicaid planning, spend down guidance, and benefit navigation. And then we also get them connected to trusted resources. That could look like maybe, like I said, the insurance providers or long term care providers or community partners. So instead of giving you a list of what to do, we walk you through it step by step. All right. So we provide resources. I'm sorry, we help with benefits more than just Medicaid benefits. So we do help with Medicare and Social Security. We help clients across multiple benefits systems. So Medicare enrollment, we provide Medicare enrollment and education and application support. So what that looks like is some people normally apply for Medicare and Social Security retirement at the same time. Typically, those benefits go hand in hand. If you're already receiving Social Security, then you'll automatically be enrolled in Medicare Part A. But you do have to apply for Part B. A lot of people don't know that. They think it's automatic. And so what normally happens is if they forget to apply for Part B, or they don't know that they have to apply for Part B, so then they'll get penalized when they finally do enroll in Part B and they have to pay a higher premium. How to avoid that is, this is a part of the Medicare education, is you've had to have been employed by an employer who has over 20 employees, who offers a health plan, or you could be covered under your spouse's health plan. Those are the two ways to avoid that penalty. But if not, you would face having higher premiums. And then also too, we help with the education piece, as far as a lot of people don't know that Medicaid provides Medicare savings programs. So Medicaid will actually pay for your Part B premiums. So that they will pay for your Part B premiums, they would pay for your co-pays, deductibles, all of that. So that's a part of managing and navigating and coordinating benefits with Medicaid. Then we also help people apply for Social Security retirement. So we do provide application support for that. We help with determining if right now is even the best time for them to retire. So, a lot of people some people have a Social Security account. And so when you log into your account, you'll see what you could potentially get if you retired at age 62, and then what you could potentially get if you retired at age 67. So just helping them understand, like, this is what you would get. It doesn't get higher if you retire too early. So that could be the difference of someone getting $1,000 a month versus $1,700 a month. That's a big difference for some people. So some people, once they see all of that, they're like, oh, I might as well wait until I'm 67. And these are the Medicare savings programs that I was telling you about. And these are some of the qualifications that you have to meet, or the income limits and restrictions. And again, just going over, they help pay for Medicare premiums, deductibles, co-pays, co-insurance, and then some of them only pay for Part B premiums. All right, so then we also help with disability. So we help with application support and denial guidance. And for that's both SSI and SSI and SSDI. And how many of you know the difference between SSI and SSDI? All right, Social Security disability income, which is SSDI, is based on work history. It's not based on income limits or anything like that. It's strictly based on work history. And it's that portion of your paycheck that gets taken out every pay period for Social Security. It's not just for Social Security retirement, it also goes into if you had to retire early because, or you had to, stop working earlier before you reach retirement age because of a disability. So that's what that portion of Social Security that gets taken out is for. And then, so it's about how much you've paid into it, SSDI. And typically, the rate that you get would be higher than if you got SSI. So, SSI is supplemental security income. So, that is for people who they have not had enough work history. They haven't fully paid into the system. They just have very low income, but they can't work. So, you'll see a lot of people, sometimes kids, are on social supplemental security income because maybe they've had an intellectual disability or a disability from birth. You'll see, young adults on that kind of income. I'm sorry, you'll see some young adults on that type of benefit because they haven't paid into it. So that's the difference between SSI and SSDI. SSI is for low income. SSDI is what you've paid into and you've had enough work history to be able to pull from it. So ideally, we would like to step in during the application, before the application process is even submitted when we're applying for Social Security disability. However, that's not always the case. So we do help with denials. But when someone comes to us before they've applied, we help them build a strong case from the ground up. We show them exactly what to track, such as symptoms, limitations, missed work, treatments. We guide them on how to document their condition and how it impacts their ability to work. We assist them with requesting the right medical records and supporting documentation. And then we also help organize everything so that way when we do submit the application, it tells a clear
To the
story.
big one. Okay. All right.
Oh, Kiana, you're not on mute. Okay. Um, So then, I'm sorry, we help organize everything so that way it tells their story clearly of, why they can no longer work consistently. So instead of just applying blindly, it's more structured and it increases their chances of approval. We don't guarantee approval, but it definitely increases their chances of approval. All right, so another benefit that we assist with is VA benefits. So we help veterans and their families get access to benefits that some of them don't even realize they qualify for, such as VA pension, aid and attendance guidance, survivor benefits. We complete the application and documentation support. We coordinate or help them or show them how to coordinate their benefits with other benefits such as Medicaid. Then we also provide crisis and critical care navigation. So this is where we often meet families and when they're most overwhelmed during a crisis. So we provide rapid response and crisis navigation. We provide hospice enrollment support when someone is, has a sudden health decline. We provide that planning for what the next steps are and immediate care and benefit coordination. And then lastly, we provide the mobile notary services. So we remove barriers by bringing services directly to families, especially when they need it the most. So we provide on-site and bedside notarization for critical documents. So we meet them whether they're at a hospital, nursing facility, home setting, wherever they are, we will meet them there. We immediately support during urgent situations and when decisions can't wait until when decisions can't wait and documents are needed quickly. All right, so community need and impact. So what we see in the community currently is we see that families are overwhelmed and underprepared. We see a lot of delayed or denied Medicaid applications due to simple errors and mistakes. We see a lot of discharge without clear discharge plans or longevity support. We see increased caregiver burnout. And then we see a lot of lack in step by step guidance, miscommunication between agencies, and families just falling through the cracks due to just lack of help that's out there. So, our impact is we help get faster Medicaid approvals. And when I say faster, I don't mean that we change the speed of how the state processes. We just prevent delays that slow them down. So many Medicaid applications get delayed or denied, not because someone isn't eligible, but because something is missing or incomplete. So, for example, we had a client come to us after she had already submitted her Medicaid application, and it had been over 30 to 45 days, and she hadn't heard anything. She had no updates, no approval, nothing. So after we completed a full assessment and troubleshooted the case, we quickly identified the issue. She missed or she didn't submit the Appendix D form, which is the long-term care Medicaid portion of the application. And this actually happens more often than you think because the Appendix D um, is the long-term care portion of the Medicaid application, but it doesn't automatically come with this standard application. So if you just ask for a Medicaid application, they're not going to give you the Appendix D unless you know to look for it or to ask for it. I mean, that's even if you go on the website. It's just not, unless you know what you're asking for, it's just not a part of the application. And so without the application, it is considered incomplete, and the case will just sit there and then it gets delayed and eventually it'll get denied. So what we do differently is we just ensure that everything is complete and accurate and submitted the right way the first time. We know exactly what documents are required. We submit complete applications up front to avoid any back and forth with DSS. And then we proactively address issues before they turn into delays. So instead of waiting 60 to 90 days for no answer, we help move the process forward by eliminating the common breakdown from the start. We also reduce discharges and delays. We improve placement outcomes and we help families feel supported and not lost. So, our partner value. So, ClearPath doesn't operate on the outside. We partner alongside your team and clients to reduce day to day burnout. We close system gaps and keep cases moving forward. We become an extension of your workflow. And so we support assisted living facilities, skilled nursing facilities, group homes, and community based clients and families and organizations. So for assisted living facilities, many assisted living facilities, they don't have a dedicated social worker, but they still manage complex resident needs every day. So where we step in is not just as a resource, but as a clinical and benefits partner that your team can rely on. So how we partner with you is we step into complex cases with your staff. We join conversations with families and help navigate expectations and decisions. We support real-time problem solving when residents have health declines or significant change. We assist with documentation, care coordination, and next steps. And then we bridge the communication between families, providers, and benefit systems. We also manage transitions to higher level of care, whether that be hospice or SNF. We we provide, we help with auxiliary grant applications and eligibility. We provide help with VA benefit navigation, long-term care planning conversations, and family education and decision support. All right, and then for skilled nursing facilities, one of the biggest operational and financial challenges that skilled nursing facilities experience is Medicaid breakdowns. So a lot of missed Medicaid renewals, incomplete applications, or delayed approvals. And so what we do, how we partner with you all, is we work directly with your admissions and billing teams and social services, and we create a structured, proactive Medicaid workflow. So we track and monitor every Medicaid case monthly. We identify risks before coverage lapse occurs. We handle any requests for information, renewals, follow up with DSS, and we maintain ongoing communication with eligibility workers and provide real time case updates so your team isn't guessing on what's going on. This helps reduce time spent chasing Medicaid updates. It helps the back and forth with DSS, missed deadlines and renewals, confusion around case statuses, and financial loss. And so we offer two flexible options for these models. We can either teach and train your staff on how to manage this internally, or we can operate and manage these systems for you as your retainer partner. We also provide front end support. So we also partner with facilities on the front end before admissions even happens. How we help with that is we work with families who are stuck in the Medicaid process. We step in when applications are pending or incomplete or denied, and we prepare and submit strong and complete applications to help to help facilities feel confident in accepting Medicaid pending residents. So when to refer to ClearPath? Most clients come to us during a crisis or urgent situation. Families may feel overwhelmed or unsure what to do next. You may have like Medicaid pending or denied. A loved one is being discharged from a hospital or SNF. Placement challenges to higher level of care. Repeated hospitalizations due to sudden health decline, and ongoing confusion about benefits or coverage. But we also want to provide services before a crisis happens, and making sure that families are prepared. So individuals who are preparing for long-term care needs, getting documents in place such as power of attorney, living wills, advance directives, understanding Medicaid, Medicare, VA, and disability benefits, and exploring care options early. So ask yourself this. If something was to happen tomorrow, would you or your loved one truly be prepared to make the right decision? If that answer is no, then that is exactly why we're here. We don't just help in a crisis, but we make sure that you are never caught off guard in the first place. And so what makes us different? What sets ClearPath apart is how we bridge the gap between care and benefits, and we don't just provide information, we offer step-by-step guidance so families feel informed, supported, and confident. Every client receives a tailored strategy based on their unique needs, understanding both the clinical and benefit side. We're able to connect the dots and advocate that and keep the cases moving forward when systems become confused or systems become confusing or delayed. Beyond crisis support, we focus on preparation and empowerment, helping families plan ahead so that way they're not overwhelmed, but they're ready when the time does come. So before we close out, I just have one more polling question. Which area presents the greatest challenge for your clients? Is it Medicaid eligibility and application process? Is it long-term care placement? Is it care transitions or understanding available benefits / resources? Or is it coordinating services and follow-up care? Okay. So coordinating services and follow-up care seems to be the most. We help with that with care navigation. That's exactly one of the services that we provide. Okay. All right, so we love to continue working with you all beyond today. So Chanel is going to drop our referral partner link in the chat. And then she's also going to drop in that end of the session survey that we were talking about. So if you can just take time and get that survey completed, it really, really helps us out. If you feel like this session was informational, then please share. We do plan on doing more of these, so please share with your colleagues or people in the community. We don't just do community partner informational sessions, we also offer informational sessions for caregivers. So if you know some caregivers that can use this information, please let us know. Don't hesitate to reach out. We love to put something together. And so we love to stay connected for referrals, resource sharing, and ongoing collaborations. And we believe that education should be accessible. So again, we do offer those free educational sessions. And then we also offer paid training too. So if you need professional development, or you work in a company that you would like to know more about Medicaid and how it works and have some in-depth training, we provide step-by-step development and workflow creations, Medicaid tracking and renewal and documentation systems, and real case scenario training and problem solving. So we do offer that as well. And our referral process is really, really quick. All you have to do is just send the link or use the link that we provided to send a referral, or you can always email us and then we'll do a quick consultation and then we'll follow up and keep an open communication. I also wanted just to provide a freebie. So we do have a free resource available. It's our free long-term care survival guide. It was created by ClearPath. So if you could just scan the QR code here, you can download it and you can share this as a resource with your clients. If you're a caregiver, you can scan it. It's very, very helpful. And you can share this with anyone. All right, so do we have any questions in the chat? Anybody have any questions about anything that we went over today? And I'll give you a few moments to get this. And then Chanel dropped the survey in the link and also the referral link. So please please complete the survey, please, please, please. And then also please save that referral link. So that way, if you have anyone, you can always just send them to us via the referral link or email. So Chanel, could you put our email in the chat too, just so they'll have that?
Yeah, and I also added our website, so you guys can look at that at your leisure as well. But I will put our email in there as well.
Perfect. All right. So if anyone has any questions, please feel free to put it in the chat. If you don't have any questions, again, we really, truly appreciate you for taking the time to be here tonight. Please share this information with your colleagues. And then, please share this information with your colleagues, and we'll be happy to put together another informational session. If you want an informational session that's tailored to more of what you need, all you have to do is send us the email and say, hey, we want an informational session, but we need it tailored to these specific topics. And we can put that together. So just let us know what you need. We're here. We want to get our names out there because, again, we do want to grow and be able to provide help to everyone. So getting our nonprofit off the ground, this is really going to help with that. So if you guys can please complete that survey, that'll be great. And I'll
if you
hang out
guys,
here. Oh, go ahead.
no, I was going to say, if you guys can't think of questions now, of course, that's our email, and you can send us an email, whether it's Shay or myself.
Yep. And I will hang out here in case anyone has any questions. If you don't, again, thank you for joining. We really appreciate it. And that concludes our session for today. So if you, like Chanel said, if you think of anything, please don't hesitate to email us.
Thank you, guys.